For me, patients are like an angel. They give me in a card, they say beautiful things about how good they feel. I mean, how can I tell you this? They say, doctor, you are an angel. You were an angel for me, and I don't want to cry. The patient is going to receive the stem cells just immediately taken off from the lab. So the stem cells are fresh. 98% they are alive.
Dr. Rebecca Lopez, founder and medical director of a leading stem cell therapy center in Tijuana. With over 37 years of medical experience, she's here to explain how stem cells could transform the way we treat chronic diseases.
Read about stem cells, and you're gonna be surprised about the beauty and again the miracle that stem cells can do for you. Hi, I am Dr. Rebecca Lopez. I am the founder and medical director, and it's a pleasure being here with you. So our institute, we have 37 years experience treating patients with chronic and degenerative diseases. I'm graduated from the Universidad of Veracruz. I'm born and I was raised here, but I went there because at that time it was the second best university in the country. My father had sent me there, so I made my career in Veracruz. So my first specialty, it was on something like internal medicine. I'm a specialist in family medicine. And after that, I made a second specialty in the United States in regenerative medicine. So you can see I have a lot of experience. So I am the founder of this institution, and we have treated patients from all over the world. They are coming here and they are very satisfied and happy with the results, the outcome. Excellent. So we have a lot of good references. I think it's very important that when the patient contacts us, he speaks with me. He doesn't speak with a coordinator or another person. The patient is going to get the information directly from me. So the patient, because it's very nice when you speak with someone who knows what is your problem, how can help you, and to explain you the treatments, what is the best option of treatment for you, depending on your diagnosis. And our treatments are customized for each patient depending on their needs, their diagnosis, the current situation. So that's why it's very important that we give the right information to the patient. We can talk about any disease that you can have, and I can give you the best information to answer your questions. So just be sure that if you're going to call, that you're going to speak with Dr. Lopez, and she's going to answer all your questions. I have a special place, and there is a lot of cards there. It's a room just for my cards, because the patients, they are so nice. For me, patients are like an angel. They give me, in a card, they say beautiful things about how good they feel. I mean, how can I tell you this? They say, doctor, you are an angel. You were an angel for me, and I don't want to cry. This is one of the reasons that I am glad that I am on this earth, because God, He gave me the chance to help many people. So I have a lot of very good memories, and I still having cards from patients that they came and we are in touch. Yes, it's very nice. We treat oncological patients, cancer patients. With them, it takes between 5 days, 6 days. But patients that are going to receive themselves, the maximum is 2.5 days. Sometimes, if you say, you know what, doctor, I have knee problems, I want to avoid a knee replacement, it can be done on the same day. It can be done on the same day, but the patient is going to live until the next day. For sure, our patient, they are going to spend one night here in our facilities, one night, and on the next day, they can leave. But it's only with patients that they have joint problems, and it's nothing real complicated. But like I said, it will depend of the diagnosis of each patient, and it will depend of the protocol that we have developed for the patient. The patients, they want to still having, the improvement, and they want to keep feeling good and improving the quality of life. Some of them, they return every year. Some of them every 2 years. Most of them, they returned. I'll give an example. One of my patients, he called me maybe the last week. And he was telling me, I did the treatment 15 years ago because I have a problem with my spine. I mean, I was perfect for 15 years, and now the pain is coming back. And I say, 15 years? It's a good time. He's coming the next week. But some patients, they do the treatment just one time because they feel okay and it's enough. But some of them, they want to go back because they want to, like an anti-aging or like a booster. Fortunately, patients and people in general, and I'm glad about that, they are researching more about stem cells treatment. So it's not like the old times that nobody knew about stem cells. Now it's different. So most of the time when I speak with a patient, they have at least the basic information, and that's very good because the patient can understand what are we going to do. Something that is very good and it's very important that the patient knows is that the patient is going to receive the stem cells immediately taken off from the lab. It's not going to be 30 minutes later, 1 hour later. It's just maybe 1 minute. So the stem cells are fresh. 98% they are alive. There's always a loss of stem cells because some of them they die because stem cells, they are very delicate. If you don't take good care of them, they are gonna die. So that's why I don't recommend to do like I said, stem cells. Sometimes they come in a bottle or sometimes no. It has to be fresh stem cells. The patient can see that we are getting the stem cells on that specific moment and that is going to receive a very, very high percentage of live stem cells. My patient or the patient is trusting in me and I have to say the truth. I'm not gonna say, okay, you have a car accident or a motorcycle accident and you are paraplegic, you have a spinal cord lesion important that it was sectioned. No, I'm gonna say no. Stem cells can bring you other benefits. Stem cells can regenerate, for example, your joints. If you are doing exercise, you cannot walk, you cannot move your legs, but stem cells are gonna help your joints to make them, be more stronger and to regenerate your every day. That's why we are getting older because every day we are losing capacities and lots of cells are dying and we don't produce enough amount of stem cells. That's why we are getting sick, we are getting old because our body is not producing a good amount of stem cells. If you are a certified clinic, there's no way that you can do these kind of things because, like I say, the COFEPRIS is so strict that they check you every month, every week, seeing that everything is fine. So in that way, the patient can feel very comfortable and confident, for sure. There is a different type of stem cells, but the most important are the autologous stem cells that they are coming from your own body, like your adipose tissue or your bone marrow. And the other one is the allogenic stem cells. That is from, for example, donors like an umbilical cord, certified umbilical cord we are talking about. Mesenchymal stem cells from umbilical cord, and they are excellent. Another type of stem cells that they are allogenic from a donor, and we are talking about the pre-differentiated stem cells. If you have a kidney failure, I will offer to you to treat you with these pre-differentiated stem cells because I can give you pre-differentiated stem cells for kidney. And these stem cells, they have a target organ. They will just match with the kidney. They are not going to be going to the lungs or, other parts of your body to do the regeneration. They will go directly to the organ that they belong. So we have pre-differentiated stem cells from kidneys, from lung, for heart, like cardiomyocytes. We have the chondrocytes that they are excellent for joints. I like to combine, mesenchymal stem cells from umbilical cord and with pre-differentiated stem cells. If you have a specific disease, we'll use that. You have a central nervous system disease like MS or like a Parkinson's disease, I will give you pre-differentiated neural stem cells together with mesenchymal stem cells from umbilical cord. Everybody, deserves to be healthy. There is clinics in the United States, I think they do umbilical cord stem cells, but they are very limited. I mean, the doctors, their hands are tied. I'm pretty sure that there is a lot of doctors that they have a very good knowledge about stem cells, but most of the doctors, they don't. Some doctors, they do, and there's some clinics, but like I said, they are very limited. They have just mesenchymal umbilical cord stem cells, and that's it, no more. So that's why people from all over the world are coming with us. If you have a disease, you're a candidate to receive stem cells. There doesn't have to be a very specific disease. It could be a patient that is 70 years old or a patient that is 75 years old, and they want to do stem cells just to get, for wellness, like an anti-aging. So no, it's not exactly like it should be a specific patient. Patients with spinal cord injuries, they were a section on the spinal cord. Stem cells, they are not going to reconnect the spinal cord, so they are not a good candidate. You can try, for example, if there is a spine injury, it was not sectioned totally, we can do the treatment. So cancer patients, they don't qualify for stem cells. Why? Because stem cells, they are very rich in growth factors, and growth factors can grow a tumor. So it's not good for cancer patients. Patients that they are totally blind, patients that they were, they're having Parkinson's disease, but it's very advanced. Why? Because we want to be honest with the patient. And sometimes stem cells are not going to be a good option because the disease is very advanced. It's a lot of complications. And I'm not saying that they are not help. They can help because stem cells, they are going to regenerate other organs. But if the patient, for example, a spinal cord injury, if the spinal cord injury was, sectioned, we cannot say to the patient, you're going to walk, because it's not going to happen. We have to say the truth. Let's talk about patients that they need a hip replacement or a knee replacement. It's fantastic to have an option, in this case, stem cells. Why? Because stem cells, they are going to regenerate the joint. The patient is going to avoid to have the surgery because a surgery is not easy. It's painful, and most of the time doesn't work very good. So the patients, they want good results. And like I said, now in present time, a lot of people, they have information about stem cells and the beauty and the miracles that stem cells can do. If you're gonna have a heart surgery, if because your fraction ejection is pretty low and they are suggesting you to have surgery, a heart surgery you can be terrified about to do that. So when a patient decides to do stem cells instead of a surgery, it's because they want to avoid the high risk of the surgery. I'm not saying that the surgery is bad. No. Sometimes the patient needs a surgery, you cannot avoid it. But most of the time they don't. This is one of the good things of stem cells, that they can create healthy and new tissue and replace the degenerative tissue. Parkinson's disease, for example, the patient, start having the tremors and the complications that they have. Of course, we can help, but if a patient has more than 20 years with the Parkinson's disease and is very advanced in a wheelchair, stem cells, they don't want to make him to stand up and start walking. And we always explain this to the patient. What the possibilities are to have very good results or to be, real and to explain how the patient, how can he or she expect from the stem cells. So the patient will make the decision. How stem cell can help a patient? Stem cell is not going to cure a patient with AIDS. It's not going to cure a patient, but it's going to regenerate the liver. It's going to improve the liver function. It's going to improve the pancreatic function. It's going to improve the muscles, the joints. All that is damaged because the disease, and because if there is a damage because of treatment, the stem cells are going to help in that. I do not recommend stem cell for a cancer patient. Telling you the truth. Why? Because, like I said, the stem cells, they are rich in growth factors. So the growth factors are going to make growth tumors because cancer grows like this, tumors grow like this. So I do not recommend. We don't do stem cells in cancer patients. But I just want to let you know, the patients that look for options. Sometimes when they make the diagnosis, it's like a sentence of, that something bad is going to happen. Look for help, read, do research, read about stem cells. And you're gonna be surprised about the beauty and again, the miracle that stem cells can do for you.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.